So I'm going to go ahead and I'm going to demonstrate how to do an IM injection as well as a subcutaneous injection. I already verified all my MAR and physician's orders information. All this is good. My calculations have all been done. I'm just going to all I have to do is demonstrate this and then go over where the spots are. I already washed my hands, gloved up, so we're good to go. Patient information verified and everything. So I'm going to go ahead and I'm going to start with my IM injection. So what I'm going to do is I'm going to do a morphine injection. For IM injections, there are several spots where you can give them. You can give it on the deltoid muscle, which is a good way to find it is you do it about hand's breadth or 3 fingers below the acromion process in your shoulder, either side. Then you can also do on the ventrogluteal muscle. Good way to find it is to palpate the greater trochanter with your palm. If you're doing it on the right side, use your left hand. If you're doing it on the left side, use your right hand. Palpate the greater trochanter with your palm. Put your pointer finger on the anterior superior iliac spine. Put your middle finger on the iliac crest, and then I'll give you a nice little V, a little good area there for where the muscle is. You may have to adjust this a little bit if your hands are bigger or smaller, but that'll give you a good idea. And then I can also give the injection on the vastus lateralis on the leg, which the good way to find it is about a hand's breadth below the greater trochanter and a hand's breadth above the knee. In that area, you should be good. All right, so I'm going to go ahead and get this ready. I'm going to go ahead and break this away from me. I have another nurse in here with me, and they can see that I'm going to go ahead and drop all this, and I'm going to go ahead and break this first. All my fluid is down at the bottom. I'm going to go ahead and break it away from me. Alright. And then this will go in the sharps container. Go ahead and just set that right there. Get my needle. Just need a filter needle at first. Okay. Alright, I'm going to go ahead and be careful not to touch that, and I'm going to go ahead and drop the fluid. I'm going to go ahead and draw up as much as I can, because once it's open I can't reclose this because it's an ampule. So I'm just going to go ahead and draw all of it up. Okay. Alright. So then this will go into the sharps container. I have another nurse here to verify to see that how much I've gotten. I do have some air up the top, so I am going to be pushing that out when I also inject up to what I need. I'm just going to go ahead and recap for just a second here. I have a bubble here at the bottom so I can get that off. There we go. Okay. I'm now going to have to waste some so the nurse can see. I'm going to go ahead and first squirt up the bubble. I'm just going to grab something so I'm just not squirting it all over the table. Okay. So we're going to go ahead and squirt it. There's the air. And I'm going to squirt up to 1.5. Okay. So I will be wasting half, a little over half, so you can see it's going to be 1, 2, 3, 4, 5, 6.6 milliliters, up to the 1.5 mark. There we go. Nurse has verified that. Okay, put that there. I'm going to go ahead and get this ready. This is going to be my the needle I'm going to use. We're using a 23 gauge needle. It's a little more viscous, but and also because it's an IM injection. So I'm going to go ahead and just pop this needle off. Maybe.
Is it not cooperating?
There we go. And then go ahead and put that in the sharps. Pick that up. And then make sure to go ahead and I'm going to clean my patient. Alright, and then this will go in the garbage. Alright. So I'm going to make sure I put this in the correct spot. If you give one of these injections, also make sure that you rotate your IM spots. Don't give it in the same one twice in a row. Alright, I'm going to go ahead and uncap this. Go ahead and displace the skin. I'm gonna go in at a 90-degree angle. Aspirate a little bit. All right, we're in the correct area. I'm gonna go ahead and give my injection. All right, give it just a couple of seconds just to make sure it gets in there correctly, and then go ahead and lift up. All right, at this point, I'll go ahead and snap that. Just for the safety of today, I'm gonna go ahead and just close that, but normally you just snap that off, twist it, and throw it away. Go ahead and put that in the sharps. And then this could also go in the sharps because it has trace amounts of the morphine in it. All right, so now I'm gonna go ahead and I'm going to do my subcutaneous injection. So sub-Q injections can also be given in several spots. They can be given they can be given on the arm, on the lateral aspects of the arm right around here and here. They can also be given on the abdomen, making sure to stay around 2 inches from the belly button, especially with certain medications such as heparin. You can give them on the anterior aspects of the thighs. You can give them on the shoulders just below the scapula, not to make sure, because you don't want an area that's too bony. And then also in a small area on the back, outside of the spine and just above the gluteus. So I'm gonna go ahead, I'm gonna do an insulin shot. So first thing I'm gonna do is I'm gonna go ahead and open this up. And we're going to do 16 of the MPH and 9 of the regular. So I'm going to go ahead and I'm going to inject 16 units of air into the NPH first, being careful not to touch the medication. I just touched that, so I'm going to get a new one of these real fast. Thank you. I'm going to go ahead and clean this off first. Alright, and then these will go in the garbage. Now I'm ready. I'm going to go ahead and look at this. We're going to do 16 of the, inject 16 units of air into this one, being sure not to touch any of the insulin itself, just injecting the air. Okay. And then we're going to do 9 into the regular insulin. Alright, and then I'm going to go ahead and flip it up and get the 9 units out of this. One double. There we go. And then I'm going to recap for just a moment here, because I'm going to need to mix up my MPH so we can get all the medication we need nice and evenly distributed. It's important to, once you get this drawn up, to not inject it into the MPH insulin bottle, because then it can ruin the NPH insulin. So I'm going to be careful. I'm not going to inject any. I'm just going to pull out the NPH that I need. Alright, there's that. I'll go ahead and get a new one of these. I'm just going to clean my patient's area real fast. Okay, and throw that away. Alright. So now I'm going to go ahead and get 16 units of this. So what this is going to do is I'm going to draw up to the 25. Verify that I'm up to the 25. Okay. Alright. It's all cleaned up. So I'm going to go ahead and I'm going to go at a 45 angle just because our patient is a little thinner. You can also do at a 90-degree angle depending on the patient. So I've cleaned a large area, so I'm just going to put my hand here for stability. Go ahead and just insert. And then go ahead and just give the injection nice and slow. Give it just a second. And then work it. Alright, and that is an IM and a subcutaneous injection.